Coronary angioplasty is generally a safe procedure. It relieves the block in the blood vessels and improves the blood supply to the heart muscles. Rarely the block can recur. Coronary angioplasty is the procedure of block removal using small steady balloons attached to the tip of thin tubes known as catheters. Catheters are introduced through blood vessels of wrist or groin under continuous X-ray imaging. The procedure is done in a special procedure room known as cardiac catheterization laboratory. Occasionally, a clot can form in the blood vessel after angioplasty and occlude it. This is prevented by using medications which prevent clot formation before, during, and after procedure with close monitoring of clotting function. Very rarely, the blood vessel can get perforated during the procedure. This can cause bleeding into the covering of the heart known as pericardium. If it is severe, it may compress the heart, causing a fall in blood pressure. Meticulous attention to the technique of angioplasty is the way to minimize this complication. Perforations can be sealed off using fabric-covered stents implanted within the blood vessel. Sometimes the devices used for angioplasty can produce tiny breaks inside the blood vessels known as dissection. This can lead to occlusion of the blood vessel if severe. Dissection can be treated by supporting the vessel wall using a small spring-like material implanted within the blood vessel known as coronary stent. Sometimes there can be bleeding due to medicines given to prevent reformation of clot within the blood vessel. This bleeding can occur in any part of the body and if severe can be dangerous. Prompt recognition and treatment will be life-saving. Occasionally, kidney function may be affected by the radiocontrast medication injected to visualize the blood vessels. This can be reduced by proper hydration of the patient before and after the procedure. Minimizing the amount of radiocontrast medication is done especially in those with borderline kidney function. Kidney function is monitored before and after the procedure. Even though there are some potential complications, considering the risk of the disease for which angioplasty is done, the benefit-risk ratio is high and the occurrence of these complications are low. In properly selected cases, coronary angioplasty is a relatively safe procedure.